What are cataracts? Cataracts are clouding of the eye's natural lens, leading to decreased vision. They develop slowly and can affect one or both eyes. Symptoms include blurred vision, glare, difficulty with night vision, and seeing halos around lights. Causes and risk factors. Cataracts are primarily caused by aging. Other risk factors include genetics, family history of cataracts, medical conditions, diabetes and high blood pressure, lifestyle factors, smoking and excessive alcohol consumption, exposure to UV light, prolonged exposure to sunlight without protective eyewear, and previous ocular trauma and eye surgeries diseases. How long does a cataract surgery take? Cataract surgery is a day procedure. The surgery itself takes up to 45 minutes and can be performed under local anesthesia, topical anesthesia, or sedation. What are the risks of cataract surgery? The intended benefits will be to improve vision and clarity of vision. Significant, unavoidable, or frequently occurring risks include 1 in 10 patients will need laser called capsulotomy at some future point in time. 1 in 100 patients may need further surgery due to posterior capsular rupture during the surgery. Although the risk of severe or permanent visual loss is small at 1 in 1,000 patients. Depending on the lens you choose, you may still need reading glasses, or there may be need for glasses to further enhance your vision. The lens options available include monofocal, premium lenses such as multifocal and enhanced depth of focus or EDOF lenses depending on your needs and suitability. Toric lenses are aimed to correct astigmatism. These lenses are available as monofocal toric or EDOF or multifocal toric. Monofocal lenses will give you clear long distance, but there would be a need reading glasses for intermediate and reading vision. Multifocal lenses is aimed to give clear long, intermediate and near vision, but may have a period of neural adaptation and patients may have halos and glare at night. EDOF lenses will produce less of halos and glare at night. It is aimed to function well at intermediate and far distances, but patients may need reading glasses. Ms. Heng will discuss your suitability and personalized surgical option for you. Biometry. Biometry is used to calculate the focusing power of the lenses required for you. We will require a biometry measurement at least 3 to 4 weeks prior to your surgery. Pre-assessment. At time of consultation, we will also ask you for a convenient time to have your pre-assessment. This can be done in person or via telephone. It will entail approximately a 20-minute telephone call with a nurse prior to your admission, taking down your medical history and/or any medication you may be taking. Recovery and post-operative care. Following cataract surgery, patients will receive detailed post-operative instructions and guidance to facilitate a smooth recovery and optimize visual outcomes. While recovery times may vary, most patients experience significant improvement in vision within the first few days to weeks following surgery. It is essential to follow all post-operative instructions provided by your surgeon, including the use of prescribed eye drops, avoiding strenuous activities, and attending follow-up appointments to monitor healing progress and address any concerns.